I took this picture about 8 years ago. This kid's like 13 now. And it was actually, I don't know if anybody saw this a couple of years ago. I think it was last summer maybe. It was a cover photo on Michigan, the League of Michigan Bicyclists magazine, I think about a year ago. So I've gotten a lot of mileage out of this picture. This is Houghton, Michigan. I work for local public health department, Western Upper Peninsula Health Department. We're 5 counties, the 5 western northernmost counties in Michigan in the Upper Peninsula. And this is urban design panel, but we're considered very rural. We're about 14 people per square mile compared to, probably 175 in Michigan as a whole. So we have 71,000 people, less than 1% of the population of Michigan, but we have close to 10% of the land area of Michigan in my 5 counties. But I didn't do a lot of planning for my talk today, and I'm only going to talk about a couple of slides and zip through the rest because I wanted to hear everything that came before and respond to a few of the things. One of the things that I remember from one of the speakers was something about how the U.S. and the world are becoming more rural, or more urban, less rural. So even in my so-called 5 rural counties that are very remote, and thought of as kind of very rugged, rural landscapes. Most of the people live in what I would call an urban setting. They're small towns. It's not Detroit or Grand Rapids, but most of the people are clustered in small towns. They're not out on the farms anymore. So even in places that we think of as rural, they're becoming urban. And a lot of the things that are true about New York or Detroit or Flint are kind of true in my small towns too. So I kind of want to make some of the same points and talk about how they happen on a smaller scale where I live. How about that? I agree with everything that the doctors had to say earlier today. So I made a simplified chart here. Basically, all these things are going up. Healthcare costs as a percent of GDP, rates of type 2 diabetes, vehicle miles driven per capita. Interesting though, 2006 was the peak consumption of gasoline in the United States. Now, some of that has to do with fuel economy, but actually I believe, and this was pre-recession by a couple of years, actually our driving miles have peaked out. So some of that may have something to do with this new urbanism and people wanting to have shorter commutes. And maybe even someday we'll be here again saying that our percent of kids that walk and bike to school is going up instead of down. So some of these things are starting to level off. Dr. Jackson challenged me to kind of keep you guys awake by telling about a big mistake or something stupid that we did in public health. And one of the biggest mistakes is in the 1960s and 70s, we decided that it was consumption of fat and high cholesterol that leads your body to heart disease, and that was we had to have this big war on fat. And I think a lot of you that kind of read the more current and credible scientific information on nutrition now and on our obesity epidemic, we're just figuring out that we fought the wrong battle completely. It was sugar that we should have been fighting instead of fat. So one of the things I put on this chart here, this is high fructose corn syrup. They kind of invented that stuff in about 1974. And that was because, like in 1973, they didn't have a good wheat harvest over in Russia. And so this was in the Nixon administration. Earl Butz, the agriculture secretary, told everyone to plant fence row to fence row. And so they all grew wheat. And then the next year, well, they all started growing corn, and they figured out right away how to turn that into sugar and throw it into every product that we buy at the grocery store. And pretty much, I don't think that's the single cause of our obesity epidemic, because I think that the urban design stuff and the roads and the car culture have a lot to do with it. But this was our big mistake in public health, is that we started feeding everybody sugar and soda, and as that went up, our diabetes rates went up, our obesity went up, and now our chronic disease and our healthcare costs are going up, and they're all going up together. They seem to be peaking out a little bit. We seem to have just starting to level off on childhood and adult obesity rates. You heard a few references today to Robert Wood Johnson Foundation. They're the biggest foundation that works on health policy in the United States, private foundation. And I was fortunate that I wrote a grant to Robert Wood Johnson Foundation for their Healthy Kids, Healthy Communities initiative, and our area, Houghton County, was one of 49 communities nationwide that were sort of charged with trying to lead the way to reversing the trend of childhood obesity. And I'm not going to take all the credit, but I think it's starting to level off now. That's the good news. The bad news is, easy way to remember this is 1/3 of Americans are obese, 1/3 are overweight, and 1/3 are not. So it's pretty easy to remember now. But these things are starting to level off. So I guess that's the good news, is they're leveling off. But what I wanted to say about this is there's a lot of factors, and we've been talking about them today. And what we're starting to learn in public health is it's more than just putting up a billboard, and it's more than just giving the kids a pedometer and saying count your steps, and it's more than just having a poster that shows the food groups or My Plate or something like that, or telling people to count how many fruit and vegetable servings a day. It's everything you've heard all day about the environment that we live in. So I think it's a good thing we're all saying the same things. If I came up here and told you that the last two guys were completely wrong, that would be kind of bad. But I agree with everything they said. So there's that idea of social determinants of health, that your zip code, your level of educational attainment, your age, your gender, your income is a big one, that those are good predictors of your health. Related to that, and something similar, we call the social ecological model of health, and that is that you have the individual, you have these kind of concentric rings, the family, the organizational level, like say your school or workplace, then your community, and then you have like national policies. So national policy, for example, would be like prohibition on tobacco advertising, or new USDA school lunch guidelines. So those would be at the national level. In public health, we usually work a lot, or we think of health at the individual family level, what your doctor tells you to do, or when you make your New Year's resolution and go on a diet, or something like that. We're starting to realize that institutional level, like school and workplace, and then the community level, those are really important ones. And our health department, our little health department up in the far corner of Michigan, has actually been working a lot in engaging our community partners to work on that institution and community level. And I'll give a few examples. But we think that's where the really important work is right now. We call it PSE, Policy, Systems, and Environmental Changes. And that's what you've heard a lot about today, making a community where it's safe and convenient to walk, as opposed to telling people you have to go to the health club after work. I want to tell a little story, and then I'll zip through my slides, because I don't think they're really that important, and then I'd like to be a part of the discussion or the questions. But here's one of the stories that I want to say. Well, first of all, when we think about let's get in shape or something, you make your New Year's resolution. I'm going to cut out desserts. I'm going to go to diet soda or whatever. I'm going to join the health club. Well, we kind of think that's a good idea in public health too. That's been a traditional model. And by the way, when you join the health club or you start walking, if you have a buddy to do it with, you're much more successful. So we might design a program that says you're in a group, whether it's a Weight Watchers group or whether we encourage you to buy a dog, because that becomes your group and you walk your dog every day. No, really, getting a pet is one of the best things you could do for your health. But what we found is, let's say we design a project, okay? And well, you guys over here, you're going to be our control group. And you guys over here, we're going to give you the membership at the health club. And for the next 6 months, you're going to go 3 times a week before work, and you're going to do the step aerobics or the Zumba or whatever it's called that they do nowadays. And you're going to do that. Okay, and we'll do pre and post testing. And what we're going to find predictably is these guys, their health is going to go like this. It's going to improve, okay? So when I say it's going up, what I mean really is the rates of obesity and high blood pressure and things like that are going to go down. So then we stop the program after 6 months. 1 or 2 of these people is going to really catch on, and that's going to change the rest of their life. But for most of them, they're going to revert to norm. So we're going to come back at the end of the year, and guess what? Same rates of high blood pressure on the 2 sides of the room, okay? Now, when this picture on the right here, this is a design picture. I had to get some design stuff in here because, that's what we're here for. This is London. They're going to build a 30-kilometer bicycle expressway, so an 18-mile bike road. Maybe they've already built it. I think it's under construction. When you invest in environmental change, it's a lot stickier. It has a lot more long-lasting impact than if you run a program, than if you give people a pedometer or sign them up for the morning boot camp class, okay? So every dollar you spend on policy or environmental change, that's a better investment. And that's why it's important for us health guys to be talking to you design guys today. That's my main message. The other thing I wanted to say about that is, you don't have to take my word for it. You could go out and do, kind of a research the literature. There is a lot of case studies on this. I'll give you one, and it's just from memory. A guy named Julian Reed, who is from Furman University in South Carolina, he worked with our Michigan Department of Community Health a few years ago. He developed some evaluation instruments that we used for parks and trails and farmers markets. So they were some standard kind of pre and post measurements. How many people are walking on that path? Were they walking vigorously? It's an observation kind of tool to see if our environmental changes had a change in behaviors in a community. But I remember something that's always stuck with me, that he talked about a study that they did in South Carolina, one of the big urban places in South Carolina. I can't remember if it was Greenville or Columbia. Doesn't matter. What I remember is poor community, high minority population, poor health outcomes, all the stuff that we saw like on Dr. Hamami's slide about the health disparities. They had the poor health in this community. They went around the community and interviewed people. They took their blood pressure. They asked them how many fruits and vegetables they eat per day. Did they get 150 minutes of exercise a week? They did a sort of a standard health risk behavior survey walking door to door, okay? Were they diabetic or pre-diabetic? Did they have high blood pressure? All that kind of stuff. They did not give them pedometers. They didn't give them a pamphlet that said, did you know if you should be walking 150 minutes a week? They didn't give them a thing to count how many fruits and vegetables. They did no health promotion, no health education. What they did was they built a path along an industrial area, along a river, that was a place that was like old warehouses and abandoned buildings and not enough lighting. It was not considered a safe area, and it would link their neighborhood to, I don't know, some commercial zone a couple miles away. They basically went, after they surveyed everyone about their health behaviors and their health status, they went out and they built a path, and they made it a safe, well-lit parkland with a non-motorized trail, a bike path in it. They came back 3 years later and they surveyed everyone in the community again, and guess what? Those people were healthier. They were more likely to get the right amount of exercise. Their blood pressure went down, all those measures of health. They didn't tell them a thing about changing their behaviors. They just put that path in. So that's like really the message about environmental change and how design relates to individual health. And that's why we're just starting to figure this out in public health. This is going to take us 50 years to completely redesign America. It was 1963, 64. It was 1964. It was 50 years ago this year when the Surgeon General report came out on tobacco. And my dad quit smoking just that year, but a lot of people didn't. We know that the adult tobacco use rate went down from about 40% to about 20% basically over the last 50 years. That's a great public health success. I mean, we talked about immunizations today. Seat belts, don't smoke. Those are like our, clean water. Those are our big public health successes, okay? But it took 50 years for us to cut it down to 20%. And if you go and you survey people in the Lansing area and ask them, do you think cigarette use is bad for your health? 100% will say it's bad for your health. So it's not that we have a lack of knowledge there. It's hard to change behaviors. What we found out was there are 3 or 4 factors that all have to be present in your community to effectively drop the smoking rate. Really effective counter-marketing to teens, because it's youth that start smoking. Nobody starts smoking after they're 21. You start when you're young, okay? If you make it to 21, you're probably not ever going to smoke, right? But so counter-marketing to teens. But bigger than that was controlling youth access. So really having enforcement so that you don't sell to youth. So not having vending machines or other opportunities to buy tobacco. And the third one was price. So there's a very, for any economists in the room, there's formulas about this. For every dollar that you raise the tobacco tax, how much the use goes down, because especially those youth that are becoming smokers, they're very price sensitive. They don't have the money to spend $10 on a pack of cigarettes. So there's some very important combination of environmental factors that have to be there to reduce tobacco use. We're going to find out that it's the same thing with obesity and chronic disease prevention, that there's some important factors, and we've seen them on the slides there. Access to good supermarkets, affordable fruits and vegetables, safe places to walk and bike, public transit. Public transit's important because even though you're riding the bus, you have to walk to the bus stop, and then once you get into town, you're walking all day, right? So even those people, they end up getting the recommended exercise. Where I live is not a great place to be physically active because we have snow half the year and we have steep hills, so it's hard to ride your bike. One of the things we're finding out is that you can put your bike on the uphill direction, you can put it on the front of the bus, and we have those things now on our buses. We got some even in our little town, we got some grant money to put the bike carriers on the front of the buses. You can ride up the hill with your bike on the bus, and you can pedal back down or whatever. We've gone through the same thing that Michigan's looking at now with its sort of trying to transition into a post-industrial or, places where the industrial areas, the economy's gone down. How do you deal with that and have a new viable economy and a place that's a nice place to live? Houghton did that like 40 years ago, Houghton County, when the copper mining ended. In fact, the waterfront in the city of Houghton, they used to tell the Michigan Tech students, don't go down by the waterfront because it's not safe down there, that's hazardous. But what they did was, the city manager at the time used to send the planning commission, these folks, on these kind of junkets to other towns like Traverse City or Minneapolis or whatever, Duluth, and they were trying to take a look at what other communities were doing. And what they decided was, we're going to preserve our waterfront for public access. And it was kind of smart because they built the higher priced housing across the street so they could still capture tax revenue by making it a nice, attractive neighborhood, but they preserved the waterfront area for public access. So you can see a before and after picture there. For you engineers, that lift bridge in the back on the newer picture, that's the biggest of its kind in the world. I don't know. I'm not an engineer, but we got a lot of them at Michigan Tech. So what they've done over the last 30 years is really had a concerted effort to buy up private property and clean it up, remediate it, and turn it into public access. And I think it can do a lot for the health of a community, not just the physical health, the environmental health, but also economic development. So when I go from the health department and go to talk to a city council and talk to them about why they should have a new policy or a new infrastructure project that's going to promote walking and biking, safer routes to school. I don't just talk about health. I don't just want to be the scold that says, everybody's got to walk more and eat right. I talk about economic development. Example is, we have a startup business that now employs about 50 people. It's called GS Engineering. 50 employees, by the way, is huge in Houghton County. That's probably 5,000 down here, okay? So they were getting too big for their building, and they were going to build up by the airport at one of those tax-free zones. The employee said, no, don't do that. We're going to stay in Houghton because we want to be right near the mountain bike trails. So I tell those people, the real estate people will all tell you this, the realtors, that in the national magazines, that one of the most important things about where people want to buy a house is they want to be close to trails. I got to finish up? Okay. So what we've done is we've been working on trails, we've done planning, we've done surveys for bike use and put together bike plans. Does everybody know what Complete Streets is? Guys are familiar with